just, I mean, I'm going through a medication change, so it's made me like tighter.
For the line? Is it for lines?
So I'm tapering it, so it's not, it was like to help, it was like a Band-Aid medication, just a stimulant. Not anything that actually like kills lines. But yeah, it just made a lot like tighter up here, and like waking up with more neck tension. It's gotten better, but that's kind of been like the last 5 days. And so there's been some more neck pain than usual, and this thing that you kind of did last time a little bit, has been like flaring more on and off, especially whenever I have to be on a computer. This like automatically will hurt afterwards. It's like if I'm on it for more than 5 minutes.
Okay, so it's pretty significant. How about if you sit here, not on the couch?
She was also telling me that kind of like loud noises out of the TV woke her up, like her with her heart racing, like sitting in the car anytime the speed changes, that kind of change. So everything's just tight. C2 is locked on like the right side, and there's a little bit of a trigger point in both upper traps with the right source. I did some work on it, but I kind of was leaving it ahead for you.
Okay.
Mm-hmm.
And then we did some tongue strengthening, and the right side of my jaw is kind of tight now.
All right. So she's got some hyperacusis in her sympathetic nervous system is just ramped up.
Yeah.
You know, and change in position, sudden. It's like you're just adapting to environmental input is startling. I sense that her sympathetic, like the sympathetic chain in front of the ganglion, or I'm sorry, in front of the thoracic's T1 through T4. We should probably take care of that. You know, that might calm things down here. But my mind is drawn to here, so point to where you've got this pain going on.
So it's like really high up, like it's this thing, if you can see that move. But then it'll go through the longus and underneath the shoulder blade, like all the way up.
Okay. I love how you know so much about the
The
muscle.
words.
Now she's using the term. Okay, so why don't we?
I also have a shirt on under this.
Yeah, let's take that off. Yeah. Let's since I'm using this as a teaching moment. Is there a pad of paper?
And we can get you pad.
Not like a, it's got
Bigger piece?
Yeah. I can get you some sheets of paper.
How about your sheets?
We're gonna break this down.
Yeah, this is like
girl.
where this is where Bella has a problem. So this is like I'm very trying. I did this. I'm like, oh.
So, she is extended
Yep.
here. She
Yep.
needs more of a kyphosis.
There.
We need to restore this because the dysfunctions in the serratus anterior and the thoracic spine are going to inhibit her scapular muscles.
Okay.
So typically, ERSs in this area and FRSs here are the kicker.
Yeah.
They're the ones that cause a lot of problems. So
ERS is a extension. RS is no. What is it? Tell me what ERS means again.
ERS is when a vertebrae likes to be in the extended position. The facets bilaterally are closed.
Yeah.
Normal mechanics indicates that when it's flexed, the facets open.
Yeah.
Right? But if there is something that's holding that one of the zygapophyseal joints closed, it's going to force the vertebrae to rotate to that side.
Yeah.
Okay. So, all right, we're gonna do this. Here's 1, 2, 3. Sorry. Typically, I have something already. 6, 7, 8, 9, 10, 11, 12.
So those are all the segments of the thoracic spine.
Mm.
Sorry, this is eating up time.
What we've learned is that you palpate to see if there's a rotation and if they're in flexion or extension in
Yeah.
that.
Yeah, I remember you doing that the other day.
And so you can kind of
Here's
classify each
L1.
one.
This is L1. Because this junction's important.
I can write that up for you if you want. If you want me to go.
Okay, so let's just, you don't have to put the
Okay,
numbers in.
I don't.
get it.
Okay.
All right, so slump, you know, she's extended here. Let's just take a look. And put your forearms on your thighs and lean forward. Let's take this out because it's gonna, and can you write this down? All right, so C7, that's fine. T1 rotated
So
right.
which one is that? T1 is here?
Yep.
Would you
So
say?
T2, actually, C7. T1 rotated right, so put
Put
the
R?
Nope, you put the line there.
Show me real quick because I don't remember.
Okay. Here. Okay.
Rotated right. Okay.
So that's okay. 3. 3 is rotated left.
Okay.
4 rotated left. 5 is even.
So don't do anything?
Nope. 6 rotated left.
Keep going.
7 rotated left. 8 rotated left. 9 rotated left. 10 rotated left. 11 is even. 12 rotated left. Everything all the way down there's left, left, left. Even L1.
Even L1?
Yeah, so, yep, you can keep it.
Keep the left?
Mhm.
Oh, even left.
So let's go like this because from here to here, I know there's
Okay,
a
left.
type 1 dysfunction. Okay, so go ahead and sit up. Let's see what happens here. Just take a moment. All right, now stick your stomach out over your thighs and arch your back, kind of. There you go. All right, so we start over.
Yep.
7.
So C7.
C7, rotated right.
So I'm doing T1 right now.
T1 is rotated right. Rotated right. Right. Here's 4.
That was 3, right? So 1, 2, and 3 are
Mhm.
rotated right.
Correct. 4, rotated right. 5. 5 is good. 6. So, question. The transverse processes of T6 are where? Same level, half segment up or full segment above T6?
I think it's above. I don't know if it's half or full.
It's half.
Okay.
T6, rotated left. 7, left, 8, left, 9. 9 is good. 10. 10 is good. 11 is left. And everything from there is left. Okay, where are we? Okay. And then just relax.
What was the position of your hands, like palpating? Where is that?
You mean like,
Yeah.
Yeah, you just,
Are they just TPs or?
so here's spinous and then transverse. So you go over spinalis, then there's longissimus. But then sometimes if it gets bulky, you're gonna have to push longissimus aside and get the transverse
Process. Okay.
underneath it.
Okay.
Let me just see what's going on here. Da, 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 da.
it does not matter whether it's extension or flexion. I think I was grabbing the paper at this point. You're just feeling for which one's hitting your hand. Is the rotation?
Yes.
Yeah.
Which one's more posterior?
Yeah.
Okay, so let's start at the top. Okay, T1 rotated right and neutral. This is T1.
Right. This is neutral.
T2 rotated right, 3 is right, 4 is right, 5 is good, 6, good. 7 left, 8 is left. 9 is left. Left, all the way down. So we're getting down to the nitty gritty. We're gonna dissect this thing and straighten this puppy once and for all.
Okay.
Okay, so if we look at this, the behavior of L5 here,
Yeah.
this is all the same. All the way up to the lumbar spine, T12 is following the behavior of L1, right? So what's happening here? This is, 11 is following the behavior of 12,
Yeah.
correct? It's rotated left.
Right.
Same here, but this is different.
Right.
This is T11, ERS, right. Okay?
Because it's rotated
It's-
left.
Nope, here, in relation to the vertebrae below
Below
it,
it, yes.
it's the same behavior,
Okay.
but it changes here. Okay? Here, it's rotated right in relation to 12.
Mhm.
It's dysfunctional.
Yep.
This is a type 2 dysfunction. If we look at this one, this is rotated right. Oh, this is like that. Same thing here. Okay? But same behavior in neutral, but in flexion, it rotates left even more than
Yeah.
this one. This one's already rotated,
Right.
and this one is a stacked rotation on top of a dysfunction. It's a
Yes.
dysfunction on top of another dysfunction, on top of an adaptation.
Okay.
Okay, so this is ERS, left. That's even worse than this one.
Okay.
Follow?
Yeah.
Okay, so here, this behavior, same or different?
Same.
Here?
Same.
Here?
Different.
How? This one's rotated.
That's rotated right.
Right.
Mhm.
But it likes to be in flexion. So this one's bent forward, T9, FRS,
Right.
right. This one's T10. Let's look at this one.
Yeah.
Behavior is the same, rotated left. T8, FRS, left. This one, same. Okay, we don't do anything with T7. T6.
There's different and neutral.
Yeah, but looking at this, it's most likely rotated left, because look,
Okay.
inflection and
In extension.
in extension, it's the same. So most likely it's the same.
Okay.
Here, this one's okay in all positions.
Yeah.
So, this is okay, but here, it's rotated, this is looking like it might be the apex of a curve.
So, in this situation, we're gonna get you.
So it's a
It's
right
fine
rotation.
here. It's rotated right. In relation to
Is
6.
it right?
Most likely, it's a right also here. So what does this look like? It looks like it's changing direction. Because
Right.
look what happens. It changes direction.
Yeah.
So this is the apex of a scoliosis.
Uh-huh.
Where does she report pain?
Like here.
1, 2, 3, 4, 5.
Yeah.
Point to where your pain is usually.
Yeah.
Okay?
Yeah.
So she's got a change of behavior going on here, usually at that place. That is where she's gonna feel beat up.
Yeah.
Okay, because the motion has to go somewhere, it's gonna go there.
Yeah.
Right. So probably apex, okay? Rotated right. And then it gets really messy here. Okay. This is rotated right, and then it goes left. Here, same behavior. Here,
Right rotation, all three.
let's look at this one. At least we can get this one. T1. ERS. Left. T2. ERS. Right. Okay.
Why is this one a right if that one's a left?
Okay, so the behavior is the same.
Yeah.
Behavior is the same. Here,
It changes.
it changes. This is rotated right on top of T3.
Yeah.
And then T3 behavior is the same.
Mhm.
The same. You don't treat T3.
But this one's left and this one's right.
In relation to T4, not to the coronal plane. I think that's where you're getting mixed
Ah,
up.
Okay. Okay.
Yeah. So if we look at this, if these vertebrae are rotated, this is left and right, right. If something's rotated right, a whole chunk of it, what has to happen to the mechanics of the thoracic spine? What has to happen, what kind of motion is coupled with right rotation of the thoracic spine in neutral? What has the vertebrae, what
The side bend
what does
too?
it have to do?
It has the side bend rotate.
It has to side bend to which side?
In the thoracic spine,
In neutral,
same direction, I think. No? Opposite?
opposite direction. So if you look at her spine, she's rotated right, but I don't know if you can see it, but she's actually like this.
Right. Yeah.
She's rotated right, and it's actually a little bit like that.
Mm-hmm. Mm-hmm. She's deeper here. She's rotated like that, you mean?
She's rotated right, side bent left.
Okay.
Okay, okay, and so her apex is here.
Okay.
So where do we start? Anywhere, just treat me. You have a question?
I was just gonna say last time, I can't remember the connection you made, I just know that you were talking about this muscle and then like
Yes.
the ribs down here
Right.
needing to be reshaped.
Yep. But this actually takes priority.
Okay.
All right, so you got to clean up the spine before you can treat the ribs, because there could be dysfunction in the ribs on top of these dysfunctions. So let's just, typically, if we're going to follow dogma, we're going to treat from the bottom up.
Okay.
So this here, this is all the same. T12 to L5, neutral, side bend, right, rotate and left, group dysfunction.
Yep.
So we treat the apex of that.
Okay.
So what would be, let's see, is it
L2?
like 2? L2?
I know, yeah. And to think the original design
All right,
had like
let's get started.
If you look at his architecture, it looked like a normal chair in your living room. And then he like
Questions?
Before I- Yeah.
And then it looked like this. So he had his original Joseph original design is supposed to be both an aesthetic piece of furniture and a function. Yeah, I know, some kind of, consciousness that dropped in. So now I'm gonna work with a twist. I will say that right now, I can say.
Okay, put your right hand on your left shoulder. And I'm gonna get snuggly, okay?
Okay, so you're gonna hold on to that one, and I'll have you face towards the.
Okay.
SR, it says NSRRL.
Side bend right, rotated left. Pull your right shoulder blade gently down to the floor.
And use the right hand to assist, get it in front of the chest,
And stop.
okay? And if you need more work, you can always come further away, but keep it in front of the heart, easy, easy,
And again.
push it out straight.
And stop.
And if it's too heavy, you just walk in a little bit. The goal
Take a
is-
breath in.
The goal is to push it straight in front of you,
And relax.
and then just.
So you're trying to get her into left side bend, right rotation,
Whatever the
because it's in,
left side bend, right rotation.
yeah, you're doing the
Gently turn
opposite
your-
of what it is in, yeah.
Turn your body back toward me. And stop. Good. Breathe in.
So we're gonna push this right hip
And
just a little further back.
relax. All right. What's next? Let's do the. Let's do this.
At T11 says ERSR, so extension, right side bend, rotate. No,
Yeah,
extension.
No, sorry, T11.
T11, what does ERSR stand for?
ERS right.
So ERS is extension, right, rotate, side bend,
Right.
right, okay.
So in that vertebrae likes to be an extension, right side being right rotation. Okay, so the facet on the right is not opening. Okay, arch your back. Good. And relax. Okay, pull your right shoulder blade down. And stop. Do it again. stuck. So I'm just gonna
Mobilize it a little bit.
turn
So-
your body back toward me. Good. And stop.
Sure, you're resisting this way. She's resisting left. Correct?
So I am trying to get, using reciprocal innervation and inhibition to open the right facet so that when she goes into flexion, both facets open.
Got it.
All right, let's go to T10.
T10 says ERS left.
Okay. So the left Z joint doesn't open. I've got my finger right there. Put your left hand on your right. And let's start here. Just let me let's go back some more.
But you want to go into extension? You're trying to find a sweet
I'm
spot?
trying, well, she likes to be an extension. Let's get her there and then meet her at the barrier of where she doesn't, she stops moving.
Right.
There. Okay, pull your left shoulder blade down.
And you're using a left shoulder blade to get her into left rotation, left side bending?
And pull down. And relax. And again. This is an ERS left.
Yeah.
So I'm trying to actually get her in the right rotation,
Yeah.
right side bending. Do it again. And relax.
So your cue is left shoulder blade down, your left arm down into you. And then you, yeah.
So I go back and recheck. So far, everything's better. It's all cleaned up. Let's go to T9. FRS right. And have you lie on your right side.
Okay. Which end should my head be at?
Well, let's do that.
Okay.
I got it.
Actually, scoot a little closer. What did I say?
What level?
T9.
T9 is FRS right. It likes to be in flexion, right side bending, rotation. Right.
FRS right.
FRS right.
FRS right. Let's,
Sorry.
let me get just relax. Don't let me help you.
There you go, and then lean forward, reach the bar. Yeah, see if you can alter the knees.
So you're flexing to the level of where it stops moving.
I'm trying to, I start her in flexion, I try to extend her spine to the barrier
Okay.
so that we can, I don't want her to extend all the way up to T8, otherwise I'm not treating the right location.
Right.
Just a T9. Okay. All right. This leg. Do this. Actually, we'll do this. Lift your leg up a little bit. Thank you. Okay, and relax it down. Okay. Gently pull your left thigh down to the floor. And relax. Do it again. And relax.
She wants to be in right rotation, so she's
Hold down.
using-
And relax.
Yeah.
Push your thigh into me.
Muscles pulling
Good.
muscles.
And relax.
you're activating the muscles in the left leg to kind of rotate left, side bend left.
That's to engage the muscles that are holding the vertebrae in flexion.
Yeah.
So again, contract your legs.
Yeah.
Contract them, then stretch them.
Yeah. Okay.
What's next?
You are at FRS left.
Left at T8. T8.
Okay, line your other side. Alright, come this way.
And you went down to the table not because they switched over to flexion based, but just because of location of the spine.
Yes, and because I'm small, all the bigger therapists and doctors, they do it sitting. I don't like it.
Yeah.
I have better control this way.
Yeah.
With each technique, there's probably 5 different ways to do it. You just pick the one that
as long
fits
as
you
you're,
and the patient.
yeah, as long as you're going against it and only moving that vertebrae, it doesn't really matter.
Wait, where are we? T8.
T8. T8 is again in
Left.
FRS left T8.
So you can treat in side lying all the way down to from T7 down,
Okay.
and then T6 and up. You have to.
Be sitting again.
You can do it in sitting usually.
Yeah.
Usually, or supine, but not really side lying anymore because the ribs really get in the way.
Okay.
Okay.
So that's it for today. Well done. Which one are you?
All right, give me this arm.
Oh, yes.
And come with me. Good. I don't want to over rotate her.
That's what I think. I mean, I guess it's a bonsai, I suppose, in some way.
Can I have that arm back?
Maybe.
This is where my brain starts to hurt a little bit. So she's at
Wow, you've got like
FRS left.
It's like a ton of hair down here.
FRS left.
Okay, gently pull your thigh down to the floor. And relax. Do it again.
I believe, but
Again.
it may be that I wrote my notes in advance last time.
And relax.
Is this, no, no, today's.
This one's kind of, it's a little bit stuck, so I'm gonna add a little bit more stuff to it.
Yeah.
Gently push your buttock down into my hand. And relax. So it's an FRS left.
Yep, FRS left.
Okay, the right facet won't close. So what I'm doing here is side bending your spine so that the facet closes.
Yep. And you're activating, it's the muscles that you activate that I'm always confused on which to pick.
Okay, turn your body left into me. Left. There you go. And relax. Okay. Now, typically, she's hypermobile, right? But this segment is fibrotic. It's not moving. So I'm just gonna thrust it a little bit. All right, it's not gonna hurt. Okay, inhale. Exhale. There. It's okay?
Yeah.
No popping. All right. So if I go back and test. Yeah. Better movement.
Better movement.
Okay. All right. What's next?
Next one, apex is
Okay,
5.
so we're gonna leave that alone.
Okay.
Yes, I will. Friends about each other. Yeah.
This is all screwy here. Right?
Mm-hmm.
Let's treat these out and see what happens here. This is all
Okay.
not
Okay,
making sense,
okay,
right? But at least we know this. Let's treat this out and see what happens here.
yeah,
We'll
yeah,
go back.
okay.
Okay, so T2 ERS right.
You're gonna start at T2 rather than T1? Yeah.
Going bottom up.
Okay. T2 is ERS right.
All right. How about if you sit up on the edge? Are you doing okay? Yeah. Sorry, it's taking. It normally doesn't take this long, but you know I have to slow it down so I can narrate.
Yeah.
But it's good to understand it and really take a magnifying glass to it and just really take the time to clean it up.
Yeah. Is the like positioning of anything up here, influence like the position of my tongue and how like it wants to go forward a lot? Yeah.
Yeah, and do you ever teach pulling the tongue back?
Yeah, I mean, we try to retract the tongue to open up the throat. The tongue normally kind of goes out to breathe, to be able to open up the airway. That's what I understand. So it's propelling itself forward to open up the airway. That's what I understand.
Okay. Yeah, because they said in class that if you, Dr. DeStefano, Lisa DeStefano, she said it, she likes to enhance release of myofascial restraint by engaging the deep cervical flexors by pulling the tongue back. So if you put your tongue up on the roof of your mouth, you pull your tongue backward a fraction,
Oh, I just love it.
you're strengthening your longest coli
I feel
without actually flexing the neck. And it provides stabilization just like your core down here. This is another core up here. Pull the tongue back.
You said just a little bit.
Just a little bit, not forcefully. As an exercise. You know, not to necessarily keep it there during the day. This is just like isometric.
Yeah, I mean, that's kind of like throat opening almost. Like if you feel it, we do a lot of dropping the tongue and lowering the tongue and opening up the soft palate.
Okay.
But it feels the same, but you're saying keep the tongue up?
Yep, and you're just,
Yeah, it's more
Sliding it.
for bracing.
yes, exactly.
Like
It's
if-
like
if you
abdominal
need- yeah, if you
bracing,
need
but
to
you're doing
improve
cervical
kinda
bracing.
like
like
esophageal
TRA.
bracing.
It's like TRA, or your abdominal core. It's really not just TRA ever. So
So like, where should the tip of my tongue be?
don't worry about the tip on this one.
Oh.
Just get as much of it as you can plastered up there,
Yeah.
but not forced.
Take that
And
back.
you
Tongue
just
comes up.
retract it, and that'll engage this, which will help your thoracics from over engaging.
So should I try to like be in that slightly retracted position all the time, or just?
No,
Okay.
it's just as an exercise.
Okay.
Okay. All right. What was it? T2 ERS
T2
right?
is ERS right. T2 is ERS right.
So, transverse processes are the same level as the spinous process.
Yep.
Okay, bring your head back. Okay, let me get snuggly again. And I start her in extension. I take her to the point of the barrier. Still going, starting to move. Then I'm going to side bend her left, rotate her left a little bit, and engage those barriers, the feather edge. Okay, look up to your right. So using the oculocervical reflex and relax, I can get her to engage those muscles that extend and rotate her head right without overkill using the neck.
Yeah.
Right? Look up to the right. And relax. Let's bring your head down to the new barrier. So what's happening, quiz? ERS right. What's happening with T2 inflection? Look up to the right.
It's a right rotated inflection. Same thing.
Correct, so what's happening at the facet on the
Okay,
right?
so on the right, if it's right rotated in extension, it's not opening in flexion.
Correct. Good. Okay, come back up. Let's do T1.
T1 is ERS left.
Okay, so I'm gonna go with. Who do I have it next? I
Can
don't
you
even
check
know.
that?
Let's sit up a little bit more. And look up to the ceiling. Nope. Like, you can actually tilt your head this time.
Oh, I don't know, maybe I should go again.
This one again is ERS left. So you go into
This one's-
extension, find the barrier.
This one's really stuck backward. See how far I had
Yes,
to start her?
yes.
Okay. Look up to the left. Relax. And again. No.
So you're,
Probably, I don't want to start her any further back than that because
Yeah.
of the vertebral artery.
yeah,
And again.
but
Up to
you
the
you
left
have her
and
in
relax.
right side bend, right rotation,
I'm good.
Oh.
and you're activating the left side to relax those muscles on that side.
Reciprocal
Inhibition, yeah.
Now, if we bend forward. Looks really good.
Yeah, yeah, look
Okay.
at that.
Now, it's not perfect, but it's definitely better. There's still some junk here. And then 7, 1, 2. What were we looking at? 3. That looks good.
It was 5 was the apex.
4 looks rotated right. Now it's changed. This
Okay.
one looks rotated right. Go ahead and sit up and extend back, arch your back. What happens here?
It looks deeper. Where does it look deeper? In extension, it looks deeper on the right. To me, from this view.
Actually,
Or is
it's
it
the
neutral?
same. It's actually
Yeah.
the same. So this is an ERS right. It's treated.
After
It
you
changed.
cleaned, it
After I
changed.
cleaned it up.
Got it, got it.
Look up.
ERS right. So you're gonna fix an ERS right. Go to extension.
Okay, so what happens if I'm still not in neutral in this position? How can I get her head this extended without compromising the vertebral artery? I'm gonna have her lean forward, and look up. Look up, like.
Oh, I'm going to work, yeah.
I can do that.
So you can use her thoracic spine.
Instead of doing that, she comes
Lean.
forward.
Yeah,
So
okay.
you kind of mute the bottom.
Okay.
So you guys loosen that.
Moving forward now. Look up to the right. And relax.
Yeah. But, okay,
And
so we have
up
a
to the
certain
right.
number of days per year
And relax.
that we can use
And
for
again.
certain things.
And
And I try
breathe
to
from
save
here.
them
Inhale.
as much as possible, and everyone
And
takes them like it's
And-
December.
And Kathy, that left hand that you had there, you're holding that just to feel, or just to focus on that segment?
Yep, so I've got
Yeah, pretty much.
my third finger above T2,
Right.
fourth finger below T2, and then my index finger on the transverse process. So I'm monitoring its ability to do this in the sagittal plane and then in the transverse plane.
Okay.
So I've got a 3D feel of what
Is
exactly is
happening.
happening at that joint.
Yeah.
So now we go through,
But anyway, they found that each and
kind of
every
backward bend as much as you can.
Oh,
Good. And then I would probably give like cat-cow now,
Yeah,
just to
to
reinforce
move.
this, give
Yeah.
some thoracic rotations.
Okay.
How does this feel?
This feels really good. Now I'm just feeling tightness up here.
Okay, all right.
But this feels really
But
good.
is it calmed down?
Yeah, yeah.
Interesting.
Is it? And it's not as hard. It's
Yeah.
not so ropey.
Yeah.
So this is all facilitated from this
From
stuff.
that stuff.
And you can still, there's there's still some winging in here,
Yeah.
so, you know, she needs to do some strengthening and all
That
that, but,
gives you the capability to file over
Um,
150
ribs,
in a region.
you know, at this point, then you start looking at what happens to the rib when something is chronically rotated. It starts to warp over time.
Yeah.
You can get internal rotation on one side, external rotation on the other, and then you start treating
And then
those.
Africa
Okay, all right.
I know,
Thank you.
I think I promised you remolding here one last time. And then I gotta call the next person. Who's the next person?
Susan.
Oh, okay. Here.
We do have, they don't speak the Asian ones, we don't have it, but we do have someone who can speak and read Latvian, Russian, German.
All right, inhale.
Maybe Finnish,
Hold your breath, pull down.
and you can do Hungarian.
Pull your left arm
And
down.
of course, all the Germanic Swedish.
And relax. Inhale. Hold your breath.
Well, they're just
Pull down.
groups of languages,
And relax.
Mhm.
One last time.
Finnish. I know
And
he
again.
speaks Hungarian.
Hold your breath.
And Finnish.
Pull down.
Finn is kind of
Yeah.
Relax.
whereas Swedish is Sweden, Norway. And so you
After
get
that,
your
you just look.
Yeah, and then, you know, if I had more time, I'd needle this, just get
Yeah.
the remaining stuff out of
Yeah.
there. I needle this, probably just needle Maltif. Since she was all rotated left side bent right here, I'd probably do iliocostalis
Yeah.
femorum and
We could definitely do all that. I mean,
Are
we'll
you
keep
guys
that.
next, or-
No, she came
Okay.
to us before, so.
good
Okay.
luck to you.